Dental trauma caused by accident or sport injury can happen anytime. Knowing what to do immediately can be the difference between saving or losing your tooth. In this video, I will guide you through the different classifications of teeth injury and how to properly treat each one of them. My name is Dr. Obeid. I'm a board-certified prosthodontist and I practice in Chevy Chase, Maryland. If you like the contents of the video, please hit the like button and don't forget to subscribe to the channel. Teeth trauma can happen at any time to anyone, young and old. My job as a prosthodontist is to help my patients get their smile back with the best treatment possible. Teeth trauma can be as small as a chip or as big as a full tooth loss. Here is the simple classifications that I developed that can help you understand what can be done to fix the problem. So the type of teeth fractures are 1. Simple fracture of the crown with little or no dentin exposure. 2. Extensive fracture of the crown involving the dentin but no nerve exposure. 3. Extensive fracture of the crown with nerve exposure. 4. Traumatized tooth without fracture that become non-vital and discolor. 5. Tooth avulsion to the trauma. And 6. Fracture of the root without the loss of the crown. So let's look at each one of them and how to fix them. The first one is the simple fracture of the tooth with little or no dentin exposure. And that is the most common that we see, and it's a small fracture of the crown, or we call it chip, and that can be treated with direct composite bonding, and that will be done in one visit. You come in, we bond the tooth, and then you can go on with your life. The second is an extensive fracture of the crown involving the dentin, but there's no nerve exposure. And we can make sure that the nerve is still alive by taking x-rays, do some different pulp tests. When we make sure that the nerve is still alive, then we can proceed with the treatment. And the treatment of choice here is porcelain veneer that require 2 appointments. The first is to do a minor tooth preparation, and the second to deliver the veneers. But if you are too young and this fracture happened to you, then we will go ahead and do a direct composite bonding, because this is less traumatic and will cause no damage to the nerve. And at that age, the nerve is too wide and can be damaged pretty easily. We'll wait until you are at the proper age, 18 most of the time, and then we move on to the permanent restoration. Now, if the trauma is a little bit more extensive, then we have a fracture of the crown with nerve exposure. If that happened, we go ahead and perform the root canal, and the treatment of choice then is to put an all-ceramic crown. Now, sometimes we have a traumatized tooth without a fracture, and that become non-vital and discolored. So you usually get the trauma, and 2 or 3 days later, your tooth will become darker. What's happened is the nerve on the inside is dead, and what you have is the blood vessels rupture, and you have a bruised tooth in a way. We will treat this by doing multiple whitening, and eventually we can put veneer or a crown on top of it. In more advanced cases where you have a complete avulsion to the trauma, we advise patients, if they can, to look around. If the situations will allow you to do that, look around for the tooth. If you find it, rinse it with water. You can put it in a special solution or salt water, or just simply put it in water. Call your dentist and set up an appointment right away. Because sometimes what we can do is we can replant that tooth in the socket. And nowadays, we also have the option of putting an implant in, wait a few months for the implant to heal, and then put a crown on that implant and restore the smile, and you're back to function normally. Sometimes we have a fracture of the root without the loss of the crown. In this case, we go ahead and re-extract the pieces, clean the area. Most of the time, we'll place an implant and then wait a few months and put an implant crown. But remember, each case is unique, and the most important thing to do is to call your dentist right away to set up a consultation, and then we can decide on what's the best treatment moving forward. If you have any questions and you would like to contact us, please visit our website at www.obeiddental.com, or you can call the office at 301-652-9505 and set up a complimentary consultation. Thank you.